So as I'm treating the daughter, the mom asks, so do you see kids like this when they don't have an injury? And I said, so are you asking me if I see youth athletes like before the season to make sure they're ready for the season, or like mid-season to get them caught up and kind of tuned up from what they've done so far, or towards the end of the season when they're heading into playoffs or a championship game, so they are performing their best and they're reducing the risk of injury? And she said, yeah. Do you do that? And I said, yep. The smart athletes and the smart parents come in before they have an injury. Now I'm going to tell you more about this patient and how this story came up in the conversation that we're having as I'm seeing this athlete for her second visit for an ankle sprain that she's going to return to, but also brought up a possible history of knee problems that we're going to look at. So here's the whole story. So this patient came in, had an ankle sprain, did the typical, well, we better put a brace on and we better use crutches and we better not do anything for 2 weeks. So she did that for 2 weeks, then tried to walk on it, and guess what? That didn't go very well. Tried to do her own exercises at home, and guess what? That didn't go very well. So fortunately, one of the coaches that this youth soccer player works with was a former patient of mine and said, hey, you got to go see this guy. He'll get you back right on the field. Stop messing around with the stuff that you're doing at home. So she came in, got her pretty well cleaned up after one visit, not ready to go back to play yet, but did get her out of the boot and the brace and the crutches and all that junk. So second visit comes in and says, I'm feeling really good. I'm doing ball drills. I'm doing this. I'm doing that. I said, okay, cool. But the problem is when she came in for the second visit, she had K-tape on her other knee. And I said, so go ahead and take your shoes off. And while you're at it, take that K-tape off. And I said, why do you have K-tape on? And the mom kind of chuckled under her breath. And the daughter says, well, because I have a knee problem. And so I was told that I need to put tape on it. I said, so what's your knee problem? And she said, well, I don't know. We went to see the orthopedist and she didn't say anything. So I looked at mom and I said, when did you go see the orthopedist? And she said, well, in between this visit and the first time we came to see you, which it's been like 10 days, so too long in between visits. I guess she had the visit already scheduled because the knee problem was a problem before the ankle thing flared up, so they just kept it. So I said, well, you didn't mention anything about knee problem when I saw her the last time. And when I screened her the last time, that knee was totally fine. And she said, yeah, it's actually been really good for a while. It just kind of comes and goes for no reason. And we thought that an orthopedist would be able to tell us what's going on. And I said, okay. And I knew that she wasn't thrilled with this orthopedist just from her tone. And I said, okay, well, what did the orthopedist tell you? And she said, well, she said that my daughter's always going to have knee pain because she's tall for an athlete. So without even asking who they went to see, I knew who they went to see. And so I said, let me guess, you went to the orthopedic center and you saw the female gatekeeper over there that sees everybody, misdiagnoses everybody, puts everybody in braces, orders MRIs that are unnecessary. So you saw that lady. And she said, yeah, I wasn't impressed. And I said, okay, well, the person that you saw is the worst medical professional in the state of Colorado, hands down. She is wrong 100% of the time. And what she told you is 100% garbage. So she said, okay. So I said, so I'm going to check out this knee. I said, so has the knee been a problem? She said, well, like yesterday, I could feel it do something a little bit. So I said, okay. So I check out everything. So I'm going to check this out. I'm going to check the ankle out. So after I checked the knee out, found out she had some hip stuff that was a little bit worse than the previous time. Worked on some things there, educated her about that. And now this is where mom asked me the question. So I can see mom's wheels turning, and what the wheels are saying is, why in the hell am I taking my daughter to an orthopedist who doesn't even examine her, doesn't know what her history is, doesn't watch her walk or do anything, whereas this guy looks at everything and he actually fixes it. So even if the orthopedist would have looked at something, what would they have done? Said, rest? Or wear a brace? Well, she already did that, and that wasn't working. So mom's wheels are turning. I can see this is what's going on in her head as I'm treating the daughter. And then that's when she asked the question. And so I said, yeah, that's a fantastic idea, especially when your daughter is a soccer player that plays soccer year round. So when you're playing one sport year round, you're doing the same thing repetitively, and that's what's going to break down the body faster than being a multiplayer sport who plays soccer, then goes to basketball, then goes to track, then goes to swimming or whatever. At least they're changing the activities that they're doing, which is going to change the muscles that are most overly used or the injuries that could pop up. Okay. So this is the patient that you want, because now she's seen me do what I'm doing. She's seen the results. She's seen what the other option is as far as taking her daughter to an orthopedist. And oh, by the way, she went to see a physical therapist last year for this knee thing, and they couldn't figure it out either. So she's figured that out. She's figured out that I'm doing something that nobody else does, and it actually works. So there's the key. If you're not doing 180, they're not going to ask you this question. You're not going to go down the road to, here's how you can have your daughter see me when she does not have an injury, which is the most important time to see me, because then hopefully she won't have an injury down the road. Okay. So this is a fantastic example of when patients understand you have a unique skill set, and your unique skill set gets results that nobody else gets. And you're able to educate not only the patient on the table, but I'm also educating mom. So this is one of the big things that we work on in the shift and talk about in the lab weekend. When you have a youth athlete or a youth anything on the table that you're working with, you're doing patient education while the patient is on the table, but you're doing the patient education for the parent that is sitting in the chair, because the patient, the 12-year-old daughter, is not making the decision of where she's going for PT. The mom or the dad is. Okay, so I'm doing patient education on the table, but I'm making sure that I glance up and I have eye contact with mom as I'm going through patient education with a daughter, which I'm having eye contact with too. Okay, so if you want to set yourself apart and you want to go do your own thing, PTAs, pay attention. You don't need to be a DPT to go own your own cash pay clinic. You can be a PTA. If you have a skill set that nobody else has, and you get results that nobody else does because you're doing 180. Now, you can go off and open up your own cash pay clinic as a PTA, and you'll fail, just like PTs fail, because you don't have business experience. You don't have a unique skill set. You're not going to get results that are different than anybody else's. And as soon as people figure that out, that you're charging them $180, $250, whatever you're charging for a visit, that you're doing the exact same treatment that the guy down the street at the inpatient or the in-network PT clinic does for a $30 copay, you're out of business. Okay? And if you do have anybody that shows up, you have to market your ass off to get them to show up and buy your package. And once they're halfway through their package, they figure out that you're doing the same crap that everybody else does, and they don't come back and buy another package. Okay? So you need to diversify yourself, get results, then educate your patients, and then they will ask you the questions. Hey, can I come see you even though I don't have an injury? Hey, can you work with my daughter on strength and conditioning? Yes, I can. So all of those things spin off of the beginning, going through the shift, getting, being a 180 practitioner, getting the results. That's what starts the ball rolling to get you the career that you want. When you're ready to do that, the first step is to contact me and say, hey, tell me more about this shift. Tell me what you're going to do in 4 months that's going to reinvent my career, and tell me, maybe let me talk to some other people that have gone through the shift. I have people that I can hook you up with on a telephone call, and they can tell you what it's done for them. So if you needed more information, if this sounds too good to be true, if you're ready to go, contact me, DM me, let me know, and I will get you either answers to your questions or get you going so you can be in our next lab weekend, which is going to be in May. Hope to see you soon.